One thing that's really nice about the Diopsys Nova system is that it's allowed us to really diagnose patients at a much earlier part of the phase, but also to sometimes really look at a patient differently than we had previously because we only had structural ways of monitoring that patient. So we have several cases where we've had patients that we started treatment much earlier. We've also had cases where we've actually stopped treatment on a patient because we're so confident in the repeatability of the Nova VEP, the visual evoked potential, as well as the electroretinogram, that we can monitor their position and decide to retreat or not treat. We've had the Diopsys Nova system since about 2011, and we have several cases where we've been able to diagnose glaucoma much earlier, manage the disease at a much earlier state to preserve a lifetime of healthy vision for that patient. Once we were able to incorporate the electroretinogram, the pattern ERG, into our system, we're having even earlier diagnosis of glaucoma as well as many macular conditions such as macular degeneration and diabetic retinopathy, so that we can actually diagnose earlier, treat earlier, and really have a lifetime of healthy vision for that patient. I've been very fortunate to have the Diopsys Nova system since about 2011, and if I have a colleague, an optometric colleague or an ophthalmology colleague who has patients that have either macular conditions like macular degeneration, or that they diagnose and manage diabetic retinopathy, and in particular, if they manage and diagnose glaucoma, I can't recommend the Nova system highly enough, both from a visual evoked potential standpoint as well as their pattern electroretinogram.